Alzheimer's has been kind of a scary topic for me. And I think people that you get to a certain age, you see yourself doing certain things and you start to question, is this the beginning of Alzheimer's? I know we're going to get into much more depth as far as, but I think it's conversationally a place that might resonate with a lot of people.
Totally. Yeah. I mean, and it's a natural human response to be fearful and to push against something that is associated with pain. But the good news now is with many of the advances in Alzheimer's and other dementias, there are actually things that you can do about it to prevent and even reverse, as opposed to, 30 or 40 years ago, it was just, oh, we can't even make the diagnosis while you're alive, is what I was taught.
Right. Yeah.
Yeah.
They had to like study that brain afterwards.
Yeah.
Um,
It is
but
fascinating because when I'm dealing with families, and I'm even in a lot of groups for dementia care, for caregivers, and there's just so much fear, but there's also just so much lack of hope. And so I actually posted, because I knew you were coming on, I posted in a group chat and said, and there's 20,000 people, I think, in this chat. And I said, have any of you actually seen Alzheimer's reverse? And if so, what level were you in your Alzheimer's? And I was fascinated with all the answers. There was a lot of hopelessness, but there were some people that had done their research were working with doctors like yourself who are saying there's so much more to this. And people used to think it was purely genetics and it was this. And so I would love for you to tell us a little bit more about, like, what are those things that caregivers should know about Alzheimer's, and how, there's many more factors than just genetics.
100%. So I think the first thing to realize is it's complicated. So in any one case of Alzheimer's, you're looking at between 30 and 200 root causes.
For those who don't know medical terminology,
Right.
what does that mean?
I wasn't catching like root what?
Root causes. So you mentioned genetics. Genetics could be one thing making you more likely or less likely to get Alzheimer's. But there are other things like the acronym the abbreviation I use is TIME, T-I-M-E. So T stands for toxins, things like mold toxins, PCBs, pesticides, forever chemicals. We could spend hours just talking about toxins. I is for inflammation. It turns out that inflammation of the brain is associated with Alzheimer's, and I think it's one of the most important root causes. But so that I is the inflammation, M is microbes. As an example would be if you have poor teeth, poor gums, it's not very far for those microbes to travel from the mouth into the brain. And then finally, E is energy.
Right.
E is energy. And we see people who are diabetic are more likely to get Alzheimer's. Some people will call it type 3 diabetes. But there are other energetic issues that could increase your risk for Alzheimer's. So that's an example of 4 different categories. And in each of those, another category would be head trauma. So I find people with frequent head trauma are more likely to get Alzheimer's. And for each of the categories I just mentioned, you can have more than one. You can have more than one infection. You can have more than one toxin. You can have
the more factors, the more letters you have, the worse the possibility is. The greater the possibility is.
Totally. But the flip side is if you run into someone saying, I've got the cure for Alzheimer's, or it's only this one thing, it's probably not going to work out very well. I wish it would. I wish it was a simple condition to fix, but often there are many different things to take care of, and you have to do it in the right order. And then the other twist to all this is because most people, their brains have lots of reserves, often for many decades, even 30 years, the underlying process destroying the brain with Alzheimer's can be going on unless and until you actually notice this. So you could have had damage going on for 20 years, but it's only after you've destroyed, say, half of your brain cells in a certain part of your brain, that you start having difficulty with memory or following directions or interacting with people.
Mhm.
Well, it's interesting because as I've done my research, right, and you're talking about the microbes in your mouth, people for so many years, say, okay, take out your amalgams. I remember years ago, my dentist took them all out, put porcelain in. That's a huge deal. And some people just really ignored it. Oh, no, no, it's not necessary. But now when I brush my teeth, if my gums bleed, I'm like, oh, I got to make sure I don't have gingivitis, because you don't
Right.
think about those things unless you're thinking from the perspective of what does that really mean and what are some things that it could cause? Because even as a nurse, I probably didn't pay attention to that. And I think if people start paying attention to some of those things that many of us had no idea and had that attitude of, well, you got to die from something, I'm going to eat whatever I want and do all those things, but we didn't really pay attention what the ramifications would be now,
Right.
and candidly, I mean, there's days I go, oh my gosh, what was the name of that? Yesterday I was trying to think about how to peel something. And I said, like when you take the thing and I literally could not think the word peel. And I was like, oh my gosh, I
Yeah.
can't wait to talk to Dr. Josh. I'm going to follow everything he says step by step by step.
Because this whole field is complicated, and many of the viewers have their own questions and concerns, just, I would say, ask your specific questions. You may have other people out there who have the same concern.
Perfect. And if you are listening to this, feel free to jot it down below. And if we don't have answers, we'll get Dr. Josh to answer them for us. So let's start with with the toxins. Everyone talks about toxin. Like if you were giving us a handful of here's some first place to start, what would people look for to eliminate toxins out of their lives?
Right, and this is tough because we live in a toxic world. The levels of toxins are going up and up. And when I talk about toxins, I'm talking about things like heavy metals, which, I mean, it's great that they got lead out of the gasoline and the paint, but unfortunately, we still have heavy metals. Mercury, you mentioned fillings. Many of us still have mercury fillings in our teeth. Um, Arsenic. So, so, so there's this is a toxic world. Plastics, the amount of plastics in our environment is doubling every 14 years, and we find that the most dangerous plastics are these microplastics that can travel through the bloodstream throughout the body. So but what makes it confusing is normally we're not just exposed to one type of toxin. And sure, we have an amazing detoxification system that we're born with. Our liver normally does well, but it's exposed these days to so many more toxins than our ancestors were uh, decades ago, or even centuries ago. One example I'll give you is mold. So mold will produce a fatty mold toxin called trichothecene, or a black mold toxin, which once it gets into fatty tissue like your brain or fat elsewhere,
Yeah.
normally it can stay for 10, 20, 30 years or longer.
Yeah, I
So,
know people that have been exposed to molds, and they
uh,
say it is devious. It's just hard to get to. It's just got this gets a hold of you, and you're gone. I mean, so
it is,
do you
yeah.
strengthen the liver, or do you have to eliminate? I mean, how can you shed toxins out of your system? First
Right,
of all, how do you identify them? Because there might be different
right.
reasons, different ways to flush. So how do you identify that you've got a heavy metal in your body? And then how do you flush it through?
Right. So the exciting thing is we actually have tests now. We have urine tests and blood tests. We can actually look at heavy metals. We can look at plastics, PCBs, forever toxins. We can look at it. It's not considered standard testing.
Right.
You have to
So
ask for it special.
you have to ask for it. Normally, it would be an integrative or functional physician who'd be actually willing to do those tests. And unfortunately, sometimes it can take a whole month to get the results. So,
Yes, that's a little
um,
frustrating.
so, so yes, I would find a physician like myself who's actually willing to look at these toxins. But the flip side is you can actually look for the first thing you can do is you can look at your liver's health. You can do blood tests to measure, do you have elevated liver enzymes? Hopefully you don't. But if you do, there's specific things you can do to help with that. So toxins would be the first thing to look at. And let's say you're concerned about it. What I tell people is there's a really small peptide, a 3 amino acid peptide called glutathione that I find helpful to do first and continue, because glutathione is your body's master detoxifier. It's an antioxidant. There's a tiny amount in food, but normally my patients will supplement with glutathione, and I feel I think this is so important. I created a website called glutathioneFirst.com
Oh, wow.
because I've been in this field for about 10 years, and I've seen dramatic improvement in patients who have toxins when I start glutathione, whether it's an oral spray or intravenous or topical on the skin. And yeah, and it's basically spreading the word.
Yeah.
Wow.
Cool.
I love that. Well, and it's interesting because when you talk about glutathione, I had researched it a few years ago and realized how important it was and started using some patches with it. And I did feel a lot better, and I got lackadaisical and I quit using them, and I realized what a difference it made. So as you and I had that conversation a few days ago, I was like, yeah, it's time to, number one, I'm making an appointment with Dr. Josh, but number two, I'm going to go get some glutathione. Oh
I
my
checked it.
goodness.
There were patches. Have you seen the glutathione patches? That's
Sure.
supposed
So
to be
there,
like transdermal. I mean, that should work. That should be. Yeah.
so
So
let's be clear. There are many different patches out there.
okay.
There are patches that will transfer glutathione through the skin. There
Mhm.
are also patches that will mimic the frequency of glutathione. I think there's a place for both. Um, but but yeah, there are many ways to deliver glutathione. I'll share with you though. My concern is I'm not a big fan of capsules that
Okay.
have glutathione, even if they're lipophilic, because as an example, if someone has black mold exposure, the black mold may embed in their gut, preventing absorption of pills or anything you're asking your gut to do. So that's why I like absorption through the skin, a spray in the mouth that can be absorbed in the mouth or intravenously. Because I've had patients suffering for 10 years with mold toxicity, and I say, well, have you tried glutathione? Oh yeah, I tried glutathione, it didn't work. Well, what form? Oh, it was
Mhm.
these lipophilic capsules, and then literally within like the first spray of in their mouth and the first IV, they're like, "Wow, like why didn't anyone tell me this?"
Yeah, they didn't
Wow.
know. They didn't know.
Yeah,
I think that a lot of our doctors are so narrow in their thinking that they're not, like open to all these different alternatives that are so, so, so helpful. So I'm getting my patches out, Tina.
all right.
Sorry. But I will go on.
Actually,
You will put your
I
website
think I'm
down.
going to do the IV. Now, does glutathione come in the sub Q form? Can you inject it just as an injectable, or is it just IV? Or
I mean, I know some people who inject it. I'm not a fan of injections just
okay,
because they're painful. I have some patients who swear by rectal suppositories of glutathione. I'm not opposed to it. To
Not,
me, the easiest is spray in the mouth, get it on the skin, and if you need something more invasive, higher doses
okay,
intravenously. Yeah,
good to know. That's good to know
so
for
we'll have the
sure.
website, right, Tina? So people can
Yes,
go, because I want to learn more about that. And you have options.
absolutely.
You tell people about the options that are available. So
Yep,
it's not just like, oh, here's the product I'm trying to sell. You're actually telling about options. Yeah.
yep,
exactly.
yeah. And we'll have all your links down below this podcast so people can check you out and check out all the information on the toxins itself. Like, is there anything specifically that somebody could do in relationship to, like, what's a step today that I could do to help remove toxins from my life? Like a basic piece of advice would, I think, each would be good, just to kind of help them think of where do I even start this process?
Yeah, so two steps you could take today. One would be to exercise or jump in a sauna. Sweating, exercising will move toxins into the sweat and then out of your body. So that's number one. Number two, I find that many of my patients are getting toxins from their drinking water. So making
Mm.
sure you have filtered water. My favorite is either reverse osmosis or distilled. So those would be two steps you could take today to, get out there, exercise, sweat, and then make sure the water that you're drinking doesn't have added toxins that will affect you.
Speaking of toxins and water, so one of the questions someone asks frequently, what about bottled water? Is we're saying plastics aren't good. Are
Most
putting your
bottled
water
water
in
is
a
in
plastic
plastic.
bottle, isn't that toxic?
Right. So I am not a fan of bottled water in plastic. So
Mm,
so that's true, but wherever I am, it's compared to what, right?
Yeah,
So
yeah, true.
so you need water to survive. I would much rather have a ceramic or stainless steel container or a glass to drink water out of. But I get it. If you're traveling and the only water is available is in a plastic bottle, then yeah, sometimes that's what I'll drink. But
Right,
but
right.
but in terms of so I don't want people to get super stressed and get overwhelmed by it. But again, when you have a choice, glass, stainless steel, much better for you than plastic because you're exactly right. Especially if the plastic bottle is heated up, and we're here in Florida where the plastic bottle you get may have in storage or may have in transit been at a very high temperature, and then you get
absolutely.
microplastics in the water. So, yeah, try
Makes
to
sense.
stay away from plastics if you can.
Perfect. So let's talk a little bit about inflammation and how does that affect those with Alzheimer's or cause Alzheimer's?
Yeah, so inflammation, meaning that your immune system is revved up too much, is one of the hallmarks that we see with Alzheimer's, with amyloid formation, etc. What's interesting is that inflammation in other parts of the body can affect the brain. So, for example, you might have an inflamed gut because you've got an infection there or toxins there. You may also have inflammation from, let's say, you've got a knee that you've got arthritis of the knee that's inflamed. Well, guess what? Because your immune system is revved up in your gut and your knee, those same white blood cells will travel elsewhere in your body, including the brain. And so, what I find is I'm looking for inflammation throughout the body if I'm trying to minimize the amount of inflammation in the brain. And what I find fascinating is that inflammation in the brain is like it's like a rheostat. It's like the setting. The more inflamed your brain is, the more likely you are to get not just Alzheimer's, but to get anxiety, depression. So if I can get you on a low inflammatory diet, take things out of the diet that cause inflammation in your gut and elsewhere, often I can turn down anxiety and inflammation in the brain.
Mm,
Okay.
very good.
Okay. I'm ready for the low anxiety diet right now. Like,
All right. All right. So,
I just put my
I should
husband
love
on it
this.
this week. I've been doing all this research and I'm like, okay, we're getting rid of all the white pasta. We're getting rid of all of it. Not to mention we've gained weight, but I'm like, we are so inflamed right now.
wow. So the two steps I would say the two food types that lead to inflammation, the worst culprits I see, one of them is dairy. So milk, cheese, have what's going on behind the scenes is when you have milk and dairy, even yogurt, you get white blood cells, actually pus from whether it's a cow or a goat, wherever this milk is from, and then you ingest it, and then your body's immune system says, "Wait, this is a white blood cell, but it's not my white blood cell. This is a foreign invader's white blood cell. I'm going to mount an
Attack.
attack on it." And so what will happen is if you cut milk, dairy, cheese out of your diet, normally within certainly a week, but even a few days, people notice, "Well, my sinuses are clear. I'm not feeling as inflamed." But people are saying, "Look, I can't. I need milk. I need cheese." The good news is that there are actually substitutes now. There are plant-based substitutes that don't have the inflammatory white blood cells
Hmm.
from the animals products that you would be drinking. So
Right.
that's class number one: milk, dairy, and cheese. The other one is gluten. So specifically, um, wheat. There are a lot of there are a lot of grains that don't have gluten, but gluten also tends to cause inflammation, even if you don't have the genetics, the HLA DQ genetics that are associated with immune reactions to gluten. Even those people can have some immune response to gluten. So
Wow.
what I would say is try cutting gluten out of your diet and then see, for a week, see if you notice a difference in anxiety and how you feel.
Wonderful. Well, and you think about caregivers, right? Caregivers are so stressed already. So a lot of caregivers are listening to this to how do I take care of mom and dad or loved one? But the reality is the caregivers need to be paying attention to all of this for themselves because caregivers tend to be the ones that take the worst care of themselves because they're so busy taking care of everybody. And so I think it's a good reminder as we're trying to help our parents or loved ones that we're doing the same for ourselves because before you know it, we'll be there, too, if we're not careful. So,
I find that that's so true, especially one of the things that can push people into disease states is stress.
yeah,
So, but I know being a caregiver is not easy, but you're exactly right. If you don't look after your own care, if your health turns bad, you're not going to be able to take care of anyone else.
I mean,
absolutely.
and so many times, Tina, isn't this true that people they're here doing everything for mom, whatever, and then they're so exhausted that the thought of doing something for themselves, it just doesn't. So they're making bad choices. They're grabbing that piece of candy or
Yeah,
gluten, like cracker, like because it's fast and it's easy, and I just don't have the time to even think about preparing fruits and vegetables or a fresh cooked piece of meat or
absolutely.
something because they're just exhausted. They're
Yeah.
just exhausted. So,
Yeah,
that's
definitely. And when
time.
you're thinking about, you're doing all this carry, all of a sudden, I think, like you said, number one is the trying to grab something fast. Like thinking ahead. It's like anything, right? If you don't plan, you plan to fail. It's in every area of our lives, unfortunately, including diet. And I'm guilty of it. I caught myself yesterday sticking something in my mouth that was like pure sugar. I'm like, okay, that's pure inflammation. What are you doing? And like, no.
Yeah, right,
So,
right. It's
anywho,
interesting because we had a sick dog today and last couple of days, and I had to
Yeah.
boil some chicken and rice, just plain rice, and that's what settles them down. And I noticed I was in that kind of like I got to grab something fast kind of mood, and I had boiled chicken there. It didn't have any extra fats or spices or anything like that, and it tasted so good. And it's pure protein. And but Tina, like you said, if I wouldn't have planned that. I just happened to have it because of puppy. But when you're cooking for puppy or when you're cooking for the family, like put an extra chicken breast or two in the oven when you're cooking and have it as backup. Pull it
yeah,
out of the freezer. So, like you're saying, you plan to have success because you're making these choices in advance for
yeah,
yourself. It's like
That's right.
thinking
absolutely,
it through. Someday I'm going to be really hungry and I want to reach for this, rather than
absolutely.
something
Couldn't
that's
agree
fast.
more.
Right. And
Well,
what's tough is the society we live in, there's advertising out there trying to get you to do things that are not in your best interest in terms of health.
yeah.
Absolutely.
Yeah, everybody has some crazy solution. I was listening to this guy today that was talking about his weight gain and how, it was just he kept stopping at these fast food doing this just because it's fast, it's easy. And, you think about even the person who right now is taking care of their young children. So they're not thinking about Alzheimer's. They're not thinking about, this stage of life. And they're stopping at McDonald's every day and all these different places because it's fast. They're going to another soccer game and all. And not only are they eating so poorly, but their kids. Like
Yeah.
I'm watching some of my family do that. And I'm like, it's like they live at these fast food restaurants. And it's just horrific. So yeah, we could go on and on
Right.
about that.
Right. But one last thing on fast food is what's missing from the fast food at McDonald's are fruits and vegetables, which have amazing phytonutrients that decrease inflammation in the brain and elsewhere. So it's not just avoiding, it's also gravitating towards more fruits and vegetables.
Absolutely. So let's talk a little bit about the microbes.
Sure. So I mentioned Mike, and these are all interconnected, right? Because
Yeah, yeah,
when
definitely.
when your body is fighting a microbe, it's going to fight it with your immune system, and that will cause inflammation. So, what I mentioned earlier is your mouth, the health of your mouth and gums and teeth, specifically. If you have inflamed gums, if you the studies have actually identified certain bacteria that are gram negative. That's technical term. What's important? An example would be P. gingivalis. We found the same bacteria in inflamed gums as we have in amyloid plaque in the brains of patients with Alzheimer's and other chronic diseases. So, what I when I spoke to a group of dentists, I said, look, in terms of working on the health of your patient's teeth, you're actually preventing Alzheimer's. And I
Yeah.
said, like, well, what you don't, you may not realize it, but it's amazing how everything is connected. So oral health, that's one area that I see of infection. Another one is, and this may sound odd, I'm seeing large numbers of parasites, Lyme disease, other infections in my patients with Alzheimer's. And
Interesting.
I think it's much more common than people realize. Now, testing for parasites can be difficult. Testing for Lyme disease can be difficult, but it's not just those two. There are viruses that can get into the brain, whether it's CMV, HSV. So normally, it's not just one infection that's attacking the brain; it's a whole slew. And what really concerns me is there's not a lot of research being done on the role of infection in Alzheimer's in humans and others. And that's just talking to researchers in the field. There's not a lot of funding available to study
Yeah,
this.
it's interesting. Well, if you think about it, who's funding a lot of the research, you know, so that's a whole nother subject.
Yeah.
We'll leave that one alone.
Okay.
So let's talk a little bit about energy in
Yeah.
relationship.
So energy. Uh, it turns out the brain is extremely, it needs a lot of energy. So if for some reason you're, let's say you're diabetic and the mechanism in the cells to produce energy isn't working, let's say you're not getting enough sleep. If you, let's say you have sleep apnea or another condition preventing enough sleep, you're normally not going to wake up with much energy. And speaking of which, the number one risk factor I see for developing Alzheimer's, studying hundreds of patients, is not enough deep sleep, deep N3 sleep, when your brain can clear out the amyloid and consolidate memories. So what's one way around this to get enough energy? It turns out, going back to what I recommended earlier, exercise. If you exercise on a regular basis, you're training the energy producer parts of your cells, what we call the mitochondria. We're training your mitochondria to produce more energy more efficiently. So some of my patients don't want to hear this, but I recommend people exercise every single day.
There you
A little
go.
something, just a little something.
Melinda's
How
all
much of
about
the something does it need to be? That's what I want to know.
that. Well,
10 minutes, a half hour? I'm serious. That's a serious
so
question.
but it's gonna vary per first of all, it depends where you are. If you're someone listening or watching this and you actually get zero exercise today, no, please don't go from 0 to an hour or 2 hours. I don't want you to overwhelm your body. So if you're at 0, start with 10 minutes. If you're at 10 minutes, double it. If you're at 30 minutes, get an hour. Now, if you're at an hour, sure, there is some benefit to go from 1 hour to 2 hour, but you can overdo it too. I mean, if you're literally exercising 4 hours a day, that's probably a little bit too much.
Mhm.
So,
then you're
um,
dealing with the cortisol issues, right? Because you're overstressing your
yes,
body.
yes.
So, one of the things that's fascinating to me, is, as you know, you've shared about reversing Alzheimer's. What have you seen working with this time framework? Have you seen people who are in the later stages of Alzheimer's actually being able to come back? Or are we just seeing in the first couple of stages that if you implement all this framework and work to get the toxin, all these things that need to transpire, and I think it's very individualized, but have you seen patients from like really, people who are not cognitive at all and not able to function actually completely be reversed? Or is that not, are we not there yet?
Uh, Actually, I have seen that. I have seen
Really?
more moderate to severe Alzheimer's being able to reverse, but it takes a lot more time because not only are you trying to fix the underlying problems, but then when you've done that, then you actually have to regenerate the brain. So it's a lot easier to prevent or from the early stage than the later stages. And to go through that process from the more severe types, it takes much more investment in terms of time, energy, money, and some people are willing to do it, but some people are not. Um, and in terms of the modalities we're using, we're not just using the techniques we've spoken about so far, which I group as lifestyle, changing what you're eating, getting enough sleep, exercising. We're using some cutting edge technologies to filter the blood, something called TPE to filter the blood. There's an FDA approved drug for compassionate use that decreases inflammation in the brain. No one's heard of it. There aren't many investigators like myself using it, but it's basically an antibody against an inflammatory protein called galectin 3.
Mm.
And then there are other techniques, including hyperbaric oxygen and peptides. So, and the key is doing things in the right order. And the key, and you want to actually you want to remove the toxins first, which is why I said glutathione first. Because if, for example, you try to kill the microbes, you say, oh, wow, I've got parasites. I've been eating sushi, raw fish, and I've got parasites. I'm going to get my parasite kill herbal preparation, which may well kill the parasites. The problem is within parasites, there can be heavy metals and other toxins. If you try to release that all at once, you can actually get worse. And I learned doing this almost 10 years ago. If you have a patient that gets worse, they're going to blame you. They're going to blame the doctor. So I learned you go low, you go slow, and you're careful in the approach. But that's the biggest message here is that there is hope. This isn't like 30 years ago where there's nothing to do, so why even test? No, there is hope, but you want to do testing to figure out which underlying causes to focus on, and then monitor and see how you're doing with removing toxins or whatever it is that you're trying to optimize.
Oh my gosh, it's like I'm not scared about Alzheimer's anymore. And this was such a great conversation. Um,
I
but
agree. I enjoyed it so much. So I'm excited for our listeners to be able to hear part 2 next week because Dr. Josh is such a wealth of knowledge. So all the links are down below. If you have any questions, you can subscribe, share this because people need hope on this topic. This topic is very complex and it's very scary, like you said, Melinda. So please share this with a friend who might be walking through this. Part 2 is going to be amazing as well. And then we're going to have him back. And any questions you put down below, he promised us he would get answers for you guys. So we'd love to be of support to you, for you, but also for your family member and loved one that is struggling with Alzheimer's.
So join us, pull up a chair, you're strong, you're seen, you're right on time. We laugh, we love, we share, we laugh so we don't cry. Join us!